Epilepsy is a very common condition. When seizures, fits or convulsions happen repeatedly, we call it epilepsy. Sometimes there will be known cause for that, which can be metabolic, or sometimes it can be some tumor pressing on the brain, like that. So then we need to treat that particular cause. There are some conditions, some cases in which we will not find any grossly evident reason for this kind of repeated convulsions. These kind of patients will be managed by medicines. Most of the time they respond very well when they take medicines regularly as prescribed by the doctor. The seizures will come under control. Not to get disheartened, they have to try, as the doctor gives additional drug or changes the regimen. It may go on for few months to years. 70% of the time it gets well controlled. In the remaining 30% of the time, the seizures, particularly we call complex partial seizures, will not get controlled. Then those are called refractory seizures, refractory epilepsy. Then these are the cases which needs further evaluation to see whether any surgical cure is possible in them. Yes, you heard it right, there is surgery for refractory seizures. For complex partial seizures, there is this particular surgery called temporal lobectomy, and mesial structures of the temporal lobe are taken out, amygdala and hippocampus. Once they are taken out, after identification, after correlating with the electrical activity, abnormal electrical activity in the brain, and by seeing the MRI, which will show some subtle signs of sclerosis in this region, once this surgery is done, many times it is a very gratifying surgery. The seizure frequency comes down drastically, and over time they also have a possibility of going off the drugs. The doctor may slowly withdraw all the drugs. So we need to create an awareness, because this is such a wonderful surgery with very good results. And there we have a lot of patients who have this refractory epilepsy. Definitely these are the people who needs to be identified and worked for a comprehensive assessment to see whether this surgery is going to make a difference in their lives. Epilepsy surgery.